Hello,
Hello,
I am Dr. Vaishnavi. Can I know your name, please?
I'm Sriram.
Hello, Sriram Garu. Today I am going to do cardiovascular examination on you. Shall we proceed?
Okay.
Thank you. Now we are going to measure the jugular venous pulsation. Sriram Garu, shall we proceed?
Okay.
So now, before examining the jugular venous pulsation, just examine the neck and fine border of the sternocleidomastoid muscle so that you can easily find the location of internal jugular vein and the carotid artery and the external jugular vein. So generally, jugular venous pulsation is a vertical distance, the oscillation point of the internal jugular venous pressure. So from that, the vertical distance from the sternal angle is generally called as jugular venous pressure. First of all, feel the jugular venous pulsation with your pads of your fingers. Generally, you cannot easily find the internal jugular venous pulse, which is seen in a carotid pulse. So, carefully, just gently press along the sternocleidomastoid muscle and you will feel the jugular venous oscillations, venous pulse oscillations. So, after finding that, now we are going to measure with a ruler and with a card. First of all, take a ruler and a card, a rectangular card. So, where did you feel the oscillation of jugular vein? Place one edge of the card there and place the one edge of the card at the ruler. So, in this patient, you will nearly see the jugular venous pulsation measure is nearly equal to 2. Generally, jugular venous pulsation may be changed when the person is standing and may be also changed when the person's head is less than 30 degrees. So, when the person is at 30 degrees, jugular venous pulsation may be 3 to 4 centimeters and it will be 7 to 8 centimeters from the right atrium. Now we are going to assess the carotid pulse. The carotid pulse is very important in assessment of any valvular diseases and the valvular stenosis. So, first of all, before assessing the carotid pulse, as in the jugular venous pulse, just examine the neck and then gently place your fingers on the medial border of the sternocleidomastoid muscles and gently press and feel the pulse of the carotid artery. Never press the both carotid arteries at the same time. It may lead to the syncope. So, generally press and feel the carotid pulse on the right side first and then on left side with the pads of your fingers on the medial side of the sternocleidomastoid muscle. So, this assessing carotid pulse includes first palpation, which we already done, and the auscultation. So, after the palpating and finding the pressure, now auscultate on the carotid artery for any bruits. So, while auscultating, ask the patient to hold the breaths to hear any turbulent flow in the carotid arteries. When a person is breathing, it may interrupt the murmurs which are present in the carotid artery. So, ask the patient to hold their breath when you are auscultating the carotid pulse. Sriram Garu, can you please hold your breath for a while? Thank you. First, take the permission of the patient to remove his clothes to examine the chest and drape the patient properly. Now, we are going to examine the heart. Examination of the heart includes palpation, auscultation, and inspection. So, before going to examination, stand at the right side of the patient and have the patient bed moved inclined towards 30 degrees. So, first of all, examine the appearance, color of the chest and the counter, and check for any uplifts. Start palpating the chest. Check for any trills, uplifts. Place your fingers obliquely and press with your finger pads gently on the chest and check for any hives, thrills you may feel there. And check at the right and left second interspaces and check for the apical impulses. You may feel the uplifting at apical impulse when there is dilatation of the left ventricle. None is observed here. Now, examine the apical impulse. Generally, you will feel the apical impulse at the fifth interspace. You feel the impulse when heart contracts and the apex of the heart comes near to the chest wall. And actually, the apical impulse is the point of maximal impulse. After that, find the characteristics and amplitude of the apical impulse. And after that, measure the distance of the apical impulse from the sternum. Mid-sternal line. The distance generally will be 7 to 8 centimeters. And the diameter of the impulse will be equal to a coin. Now, find for the right ventricular impulse. First, place your finger pads. One finger pad in between second interspace and remaining in third and fourth interspaces. Feel for the right ventricular impulse and then find the impulse at the epigastric area. You will find the right ventricular impulses highly in epigastric area when the person may be experiencing the chronic obstructive pulmonary diseases. Now, while you are examining the apical impulses, ask the patient to move to the left side in decubitus position and press gently for the apical impulses. So it will help to bring the heart nearer towards the chest so we can feel the apical impulses better. going to examine or listen the heart sounds. So before listening to the heart sounds, first know about your stethoscope. Generally, diaphragm is used to listen high-pitched voices. The bell of the stethoscope is used to listen the low-pitched voice. First of all, going to, when you are going to listen the heart sounds, start from the right side in the aortic area. So it will be easier for you and it will orient you towards the cardiac cycle. And proceed to the pulmonic area. Now listen at the apical area. Now with the bell of your stethoscope, again listen at the apical area. To improve your ability to listen the S3 and S4 heart sounds, ask the patient to move towards the left lateral half into a decubitus position so that the apex of the heart will be moved closer towards the chest, so low pitched voice will be heard better. To recheck the position of the apical impulse, place the bell of the stethoscope. Now we are going to listen the murmurs if they are present in the patient. So when you listen a murmur, you should able to find the time, shape, intensity, location, and the pitch and quality of the murmur. Carotid pulse, when you are listening to a murmur, will help with timing. First, you decide you are listening for a systolic or diastolic murmur. To detect the subtle diastolic murmur of mitral stenosis and aortic regurgitation, you should use the two maneuvers. In first maneuver, ask the patient to lean forward, and after that, ask the patient to exhale and hold the breath while you are auscultating at left second interspace and lower left sternal border and at the apex. So this maneuver helps to find the murmur of the aortic regurgitation. So we will do the procedure now. Sriram Garu, can you please exhale and hold the breath for a while? The second maneuver. This maneuver is useful to find the mitral valve stenosis. I mean murmur of the mitral valve stenosis. So in this maneuver, ask the patient to move left lateral side in a decubitus position so that the apex of the heart, left ventricle, will be closer to the chest wall. So when you auscultate, you can hear the low pitched voices very clearly in this position.